City of Erie's 5-year consolidated plan for fiscal year 2015 through 2019. I am Chris Groner, the Director of the Department of Economic and Community Development, and I'm joined this evening with the City of Erie's Grant Administrator, Dave Dieter. We're going to be going over the proposed substantial amendment, the supplemental funding, and the detailed activities for proposed activities for that funding. The City of Erie is receiving $1,866,324 in additional community development block grant funding and $931,503 in additional emergency solutions grant funding as part of the $2.2 trillion Coronavirus Aid, Relief, and Economic Security Act, known as the CARES Act. This funding will be administered through the city's Federal Community Development Block Grant Program. The federal relief package appropriated $5 billion to the U.S. Department of Housing and Urban Development for emergency community development block grants and emergency shelter grants to help cities nationwide. Erie received $1,866,324 in flexible CDBG program funding and an additional $931,503 in emergency shelter grants, for a total of $2,797,827. The emergency shelter grant is to help fund resources to address homelessness. The flexible funding allows for more varied uses. The city is amending its regular fiscal year 2015 through 2019 consolidated plan and fiscal year 2019 annual plan to add the funds related to COVID-19. Citizen Participation Plan. This Citizen Participation Plan was prepared in accordance with Section 104A of the Housing and Community Development Act of 1974 as amended. The 24 CFR 91.105 and 24 CFR 5.158 federal regulations outline the citizen participation requirements. This document has been established in order for the City of Erie to be in conformance with the requirements of the regulations. The plan sets forth the city's policies and procedures by which it encourages residents to participate and comment on various federally funded city programs and affirmative fair housing AFH planning. The programs included the Community Development Block Grant, CDBG, the Home Investment Partnerships Program, HOME, and the Emergency Solutions Grant Program, ESG. The city encourages residents to participate in the development of any consolidated plan, any substantial amendment to the consolidated plan, performance reports, and the AFH. This document outlines the city's procedures and methods to provide continuity for participation through all stages of the process. The City of Erie may also explore alternative public involvement techniques and quantitative ways to measure efforts that encourage citizen participation in a shared vision for change in neighborhoods. The City of Erie was granted a waiver for CDBG and ESG comment period. This comment period has been shortened from 30 days to 5 days. At this point, I'd like to turn it over to our grant administrator, Dave Dieter, for an overview of the 5-year consolidated plan. Dave?
Thank you, Chris. As a result of the planning process utilized to develop the city's 5-year consolidated plan for the period of fiscal year 2015 through fiscal year 2019, the following 6 priorities and subsequent goals and strategies have been identified for the Community Development Block Grant Program, the Home Investment Partnership or HOME Program, and the Emergency Solution or ESG Program. The first of these priorities is housing priority. It was determined that there is a need to improve the quality of housing stock in the community by increasing the amount of decent, safe, sound, and accessible housing for homeowners, renters, and home buyers that is affordable to low and moderate income persons and families. The goals under this strategy are as follows: housing rehabilitation, rental rehabilitation, housing construction, fair housing, home ownership, and public housing. The next priority is homeless priority, a need for housing and support services for homeless persons and persons who are at risk of becoming homeless. The goals and strategies under this priority are funding for the continuum of care, operation and support for shelters providing homeless and emergency shelters, prevention and housing, and permanent housing. The next priority is other special needs priorities, which identifies a continuing need for affordable housing services and facilities for persons with special needs and the disabled. The goals and strategies under this priority are housing for these individuals, social services, and accessibility. The next category is the community development priority, which identified a need to improve the public and community facilities, infrastructure, public services, and the quality of life for residents in the community. The goals and strategies under this priority are community facilities, infrastructure improvements, public services, accessibility, public safety, code enforcement, clearance and demolition, revitalization, and historic preservation. The next category is economic development priority, which identified a need to increase employment, self-sufficiency, education, job training, technical assistance, and economic empowerment of low and moderate income residents in the community. The goals and strategies under this priority are employment, financial assistance, redevelopment programs, and financial incentives. The next category is administration, planning, and management priority, which identified a continuing need for planning, administration, management, and oversight of federal, state, and local funded programs. As a result of the funding we are receiving through the CARES Act, we added one additional priority, and that is the need for strategic plan goal and annual plan goal entitled Provide Facilities and Services in Support of the Pandemic Response and Recovery Efforts. The goal under this priority is to assist in providing facilities, either new, expanded, or retrofitted, special economic development assistance to businesses, public services and or planning, and ESG operating costs, essential services, rehabilitation, equipment, and homeless prevention that could enhance our community's response to and recovery from the impact of the pandemic. I will move on now to the overview of the substantial amendment for the 2009 fiscal year and the fiscal year 2020 through 2024 it's the overall substantial amendment to the fiscal year 2019 annual planning process. During the public hearings for the fiscal year 2020 through 2024 five-year plan and the fiscal year 2020 annual plan on April 7th, 2020, the city announced that COVID-19 CARES funding had been allocated to the city. On April 13, 2020, the applications were due for this funding. On April 14 of 2020, the applications were reviewed and prioritized. On April 17 of 2020, an email inviting subrecipients and stakeholders to the public hearing today was sent out. On April 20, 2020, a notice was posted in the newspaper announcing the amendment to the fiscal year 2019 annual plan and public hearings to be held on today's date, April 22nd, 2020. Also on April 20, 2020, the substantial amendment was posted to the city website, as well as notice given of today's public hearings. Obviously, today's date, April 22nd, we held a public hearing at 10 a.m., and we're in the midst of the public hearing at 6 p.m. We anticipate on May 6th of 2020 that the substantial amendment to the annual plan will be adopted by City Council. Pending that approval, we intend to submit the application to HUD on the same date. I will turn it back over to Chris for the overview of the proposed amendment and fiscal year action plan for 2019.
Thank you, Dave. I'll now go over an overview of the proposed amendment to the fiscal year annual plan for 2019. Before getting into details on each activity, the reason we are amending the fiscal year 2019 plan, the fiscal year runs from July 1st to June 30th, so we are still in the 2019 annual plan, towards the end of that. It's our belief that by amending the existing current year plan, that our funds will be able to be deployed more rapidly than if we were to amend the upcoming 2020 annual plan. The Community Development Block Grant funding details for COVID-19 are as follows. There are three main categories for which these activities will be categorized. The first being buildings and improvements, including public facilities. This is to assist with activities that involve the acquisition, construction, reconstruction, and installation of facilities that could support treatment centers. There's one activity in this category. It is in the amount of $354,392.81 to St. Vincent Hospital, Allegheny Health Network, to assist with the construction of a facility for testing, diagnosis, or treatment, and to assist with facility enhancements for testing location to provide care for potential COVID-19 patients. Second category of CDBG funding is assistance to businesses, including special economic development assistance. This provision allows for assistance to private, for-profit entities when appropriate to carry out an economic development project. The activities in this category include $523,391.39 allocated for special economic development to provide grants or loans to support new businesses or business expansion to create jobs and help with the manufacturing of medical supplies necessary to respond to infectious disease. Also, support to avoid job loss caused by business closures as they relate to social distancing by providing short-term working capital assistance to small businesses to enable the retention of jobs held by low and moderate income persons. The second activity within this category is $25,700 for economic development to provide technical assistance, grants, loans, and other financial assistance to establish, stabilize, and expand micro-enterprises that provide medical, food delivery, cleaning, and other services to support home health and quarantine. The third category of funding is under public services. The public service cap has been waived. Activities in this category include $588,999 for public services. Within that category, $50,000 to UPMC Hammett Hospital, along with $32,632 to Allegheny Health Network St. Vincent Hospital. Both activities to provide training, diagnosis, and other services at a fixed or mobile location, and to provide free testing and vaccinations once a vaccine is developed. Next category, we have $75,000 going to the Martin Luther King Center, $75,000 going to the Booker T. Washington Center, $75,000 for the Urban Erie Community Development Corporation, $75,000 for the YMCA, $75,000 to the Sisters of St. Joseph Neighborhood Network, and $131,367 to the Erie City Mission. These activities will support the funding. Funding will support the effort to provide food and other resources to food insecure residents and others who are under stay-at-home orders. Also, to provide essential services and recovery programs during the COVID-19 pandemic for clients with addictions to drug and alcohol. Planning activity of $13,200 for the City of Erie Planning Department. This is to help develop survey materials to capture the impact of COVID-19 on residents in low to moderate income neighborhoods throughout the city. And the final category is management administration in the amount of $360,640.80 for program administration, planning, and management costs. That brings a total amount of the CDBG funding to $1,866,324. I would now like to do a review of the specific activities within the Emergency Solutions Grant funding. These are shelter activities. First activity is $298,672 to the Erie County Department of Human Services. This is for assisting with the operation of an emergency overflow shelter. $223,720 to the Erie City Mission to assist with operations and essential services for the Samaritan Care Emergency Shelter. $32,335 to the Erie United Methodist Alliance Emergency Shelter to help support emergency shelter activities. $25,000 to the Community Shelter Services for emergency shelter activities. $50,000 to the Mercy Center for Women for transitional housing. $208,626 to the Greater Erie Community Action Committee for homelessness prevention, including assistance with rent. And $93,150 for the Administration of Emergency Solutions, for a grand total of $931,503. At this point, I'd like to turn it back over to our grant administrator, Dave Dieter, to discuss next steps in the process. Dave.
Thanks again, Chris. Moving forward from today's public hearings, the end of the public comment period for this amendment is April 29 of 2020. We anticipate adoption of the substantial amendment to the fiscal year 2019 annual plan by City Council on May 6 of 2020. And pending approval of City Council, we anticipate submitting the substantial amendment for the fiscal year 2019 plan to HUD on the same date, May 6, 2020. Regarding the release of funds from Congress and our agreements with HUD, that date is pending. We have not received a firm commitment on when those funds will be released and when we can execute our agreements with HUD. So we're waiting for that information. We anticipate that to come out within the next couple weeks. I will now turn it back over to Chris, who will address the public comment portion of today's hearing.
Thank you, Dave. At this point, we would like to give opportunity for public comment. I do want to remind you that this is for comment only. It will not be a question and answer session or a discussion, but for public comment. So at this time, I would like to ask if there is anyone on the line that would like to make a comment, please do so.
If there's anyone on the line that would like to make a comment, please do so. There's anyone on the line that would like to make a comment, please do so. There's anyone on the line that would like to make a comment, please do so.
are muted. You can mute or unmute yourself by pressing you are unmuted.
Is there anyone that would like to make a public comment at this time? Any public comments at this time? Hearing no public comments, we will adjourn this meeting for the proposed substantial amendment. Thank you.